Hello everybody, Jeremy Latham, the hip surgeon here. Different format for me today. I'm at my little studio desk in the spare room. It's very hot out there, the window's open, so you might well hear the trains and the birds in the background. There's been some good news in the last few days. We have been told that we may well start doing elective surgery again in the private sector on the 1st of August 2020. So hopefully we'll be up and running again within a few weeks. Clearly, before we go ahead with surgery, there are some very important steps to take, particularly in developing safe patient pathways so that people are admitted to hospital COVID-free, and of course that protects both staff and patients from developing the disease. There seems to be a dramatic fall off in the number of new cases as predicted as the weather's improving. So hopefully we won't see the potential big spike in cases over the next few weeks. Clearly, if we do, then everything will be reset again, and we may well have to delay the date when we start doing elective surgery again. Nobody really knows at the moment, but hopefully, with a fair wind behind us and a bit of luck, we'll be starting to operate again fairly soon. I'm going to show you a short presentation about what to expect, because if you're waiting for surgery, clearly you want to get on with it as quickly as possible, but we do have to take some important precautions, as I mentioned earlier. I'll go through those now. First of all, you're going to have a robust preoperative assessment. Every time we see you in clinic and in preoperative assessment clinics, we'll be doing COVID swab testing. The results can take a couple of days at the moment to come back, but I think within the next few weeks we're going to see some very rapid changes in the timing it takes for these tests to return to us, and hopefully it'll be on the day. You'll have to be self-isolating for 2 weeks before surgery. This is clearly going to be very difficult for a lot of people, but it is essential that you isolate before you come into hospital, because you don't want to catch COVID or have COVID when you are recovering from hip surgery. There is some good evidence out there that if you have the disease whilst you're recovering from surgery, the hit on your immune system will be much bigger, and therefore the risk of complications is greater. So really important you are isolated for 2 weeks before surgery, and again for a week after you're discharged. Very important to stay as safe as you can, and we will be helping you along this pathway. You need to have a COVID negative swab within 72 hours of the procedure. That clearly makes a lot of sense. You don't want to be brewing the disease when you come in for your surgery. I hope that made sense. I know a lot of you are going to have a lot of questions about the proposed restart. Everyone's going to be anxious about coming into hospital. Hospitals are, of course, the places where the disease is most prevalent. We are, of course, very fortunate in the private sector to be removed from the acute sector where the greater proportion of cases is. We can keep people out of the hospital if they are suffering from symptoms and signs of COVID, and of course we will be screening people at every step of the pathway. I think we're going to see a big change in the way surgery is delivered in this country, both in the NHS and the private sector. There's got to be a far greater emphasis on transparency of treatment, protection of patients at every step of the pathway, and the days when we did several joint replacements a day, I think, are long gone. Our emphasis now is on quality and transparency, because at the end of the day, we want to do the best we can for you, the patients, keep you safe and deliver the highest quality surgical care. I hope you've enjoyed this video. If you've got any questions, which I'm sure many of you have, please get in touch with the office. The details are down below on the right hand side of the screen. You can always find me through my website, and I'll be posting regular videos both here on YouTube and also on Facebook. I've got some equipment now where I can do some live streaming, so if you've got any questions, burning questions you want to ask me live in a question and answer session, I'm going to set one of those up in the very near future. So please get in touch and stay tuned in. Thanks again for watching. I'm Jeremy Latham. I'm the hip surgeon.